John, so nice to meet you at the AAS 2011 conference in Portland, Oregon. I love the work that you're doing with school social workers.
Thank you.
Can you tell me a little bit about the study that you've done? Because there are some very interesting findings that are a little contrary to what we read in some of the literature.
Yeah, no, I'd be happy to. So this was a study that I did with my colleague Karen Slovak from the University of Ohio. And what we did is we surveyed 400 school social workers in the Midwest. And we asked them to identify themselves as elementary school, middle school, or high school for the purpose of the survey. And then we asked them, how many kids in the last 2 years have you worked with that have threatened suicide, made an attempt, been hospitalized, or died by suicide? One of the things that we found was that 75% of elementary school social workers said that they worked with kids who had threatened suicide. 23% said they worked with kids who had attempted, and 40% said they'd worked with kids who had been hospitalized for suicide.
So those are very stunning statistics because that's a little bit contrary to what we read in the literature.
Yes.
And what we typically understand is that that age group, or particularly if we're looking at 9 to 13, 10 to 14, are those people that some suicidologists would say don't really need that suicide prevention work. So I'm curious about these findings. How can we validate that?
Yeah, well, so there are a couple things you could do that we didn't do in our study, but there are a couple things you could do. One, you could do a survey or a study where you actually looked at records in the school for how many referrals were actually made for services. You could do a case chart or a chart review and look at school social workers' charts to find out what's really going on. And in terms of the 40% who were hospitalized, you could, of course, look at the hospital records. Now, we don't have that study set up. That's a lot more in-depth kind of consent kind of study.
But might that be something that you'll follow up on?
Yeah, we would love to do that in the future. Absolutely. Now, there was a second part to the study. Did you want to ask me about something else?
What I was going to say to you is I'm always curious when we're talking about school social workers because I understand that they would have a graduate degree.
Yeah, master's level.
But I know in my experience, in my graduate work, we did very little with regard to specific suicide coursework. So what are these people reporting?
Right. Well, that's a great question. That actually leads into the second part of the survey, which was we asked them to rate their level of agreement on 6 questions, one of which was, I've received graduate training in working with suicidal youth. And 57% agreed or strongly agreed with that statement, which is actually higher than school psychologists and counselors.
Absolutely.
It's much lower, though, than their reported level of agreement with how confident they are and how prepared they feel, which was between 87 and 95%.
So what do you make of that discrepancy?
Well, so there were a couple things. One, we looked at where that confidence was falling, and we found that there was a significant relationship between how many kids they had worked with and their level of confidence, their level of preparation. So that sense that I've worked with them, therefore I feel more confident. I haven't worked with very many, I feel less confident. So independent of their training.
So that frightens me a little bit.
It's a very scary finding.
Because clinically, just because I've worked with a certain population without and in the absence of adequate training and certainly utilization of best practices, I may be erring on the side of caution, or I may be making an error in terms of the students that I refer out or the students who potentially could get hospitalized.
Yes, and there's something else that's scary about this study. You ready for this?
I'm ready.
The other thing that's scary is that the numbers of elementary school social workers who reported working with suicidal youth is much higher than seems to be indicated based on the research. You said this earlier, but the implication is that they are working with suicidal youth based on trainings that they've received that were geared towards middle school and high school students. And you and I know that there's a big difference. So they're trying to use
that information with that developmental level and bring it down to the younger population.
On the fly.
We know that doesn't work.
It doesn't work. And so one of the big implications of this study is that trainings have to be developed for school social workers or any school staff member that would work with a suicidal youth, specifically related to the developmental and social and educational needs of kids in elementary schools.
You know, it's interesting. Some often talk about the suicide prevention work that's done in the elementary level. And I was listening to people today, in fact, people from Columbia University, talking about suicide prevention in the elementary population really needing to be more about mood identification and mood regulation. And if if we looked at that preventative measure, then I suppose that could carry through to different suicide prevention methods as the kids age.
Mhm.
But how are we going to get to this population of school social workers in the elementary grades who are thinking one thing that may not be true?
Well, I think one of the things is that we've got this Midwest School Social Work Council, which is where we gathered our data. There's the association. So we can go to associations like that and say, hey, we have this study, we have these findings, this is what we have. They can disseminate it. The other thing is we can just go to schools of social work. Right, there are 700 schools of social work across the country, and we can work with them to infuse this content in their curriculum, or this curriculum in their content, whichever it is.
Whichever it is.
Yeah.
And I know Massachusetts is doing that. The Department of Public Health in the Commonwealth of Massachusetts has actually started to do that with their schools of social work, identified schools of social work.
Yes.
Not with counselors, but with
Schools of social work, yeah, and I know the folks that are doing that work, and it's fabulous research. It's so important, it's so necessary, and I'm really looking forward to the day that actually comes out, because right now they're just in data collection. They haven't done the write-up.
So once again, another piece of cutting-edge work in the field of suicidology.
Just doing what we can.
Nice work. Thank you very much.
Thanks so much.